So at this ASH meeting, we're reporting data on Precision Bio CD19 allogenic off-the-shelf CAR for patients with relapsed refractory BLL. So the field of CAR T has expanded greatly, and already we have approved autologous CAR T product for these patients. One of the issues with autologous CAR T products is that you have to collect the cells from the patient, you have to generate the CARs, which takes time, and then obviously then you have to infuse the cells back to the patient. But during that delay, which could be 3 to 4 weeks for some patients or longer, the patients could progress or they can get sicker from infection issues. So if you have an allogenic product which is off the shelf, you can give the product to the patients right away. So that's the advantage of an allogenic product. So Precision Biosciences has developed this CAR T product with what is called an ARCUS gene editing technology, where they knock out the T cell receptor to prevent GVHD, and at the same site, they insert the CD19 CAR. So for this ASH meeting, we're reporting data on 15 patients with relapsed refractory adult ALL who received a median of 5 prior lines of therapy. So these patients received lymphodepletion with Fludarabina and Ciclofosfamide, and then they received a dose of CAR T cells. Now, different doses of CAR T cells were studied, and different lymphodepletion regimens were studied in this trial. So in summary picture, what we found is that if you increase the intensity of the lymphodepletion, so give more cyclophosphamide, more number of days of fludarabine, or you increase the amount of CAR T you're giving to the patient, when either of those two approaches are done, you see a more peak expansion of the CAR T and more persistence of the CAR T, which is leading to more patients achieving remission. So among the 15 patients, 9 patients received either higher doses of CAR T or higher doses of lymphodepletion. And among those 9 patients, we saw 7 achieved a complete remission or complete remission with incomplete count recovery, and 5 of these patients were MRD negative as well. And then some of these patients were able to go to an allogenic stem cell transplant. We did see grade 1 or 2 cytokine release syndrome, but no patient had grade 3 or higher cytokine release syndrome. We did see some patients with ICANS, neurotoxicity, grade 1 and 2, and one patient had grade 3 neurotoxicity, which lasted for about 2 days. So overall, I think the regimen from this cytokine release syndrome and ICANS perspective was well tolerated, and we are seeing some early evidence of efficacy with these either higher lymphodepletion doses or higher doses of the CAR T itself.